let's be clear why the number of cases will surge so quickly, because he is taking all protections off in one go. That is reckless.
Meow, Huples cat in the near wilds of Newmarket. Just want to talk today about recklessness, data, politics, normalcy bias, and what is actually going on right now in terms of COVID, and why the unvaccinated are literally being thrown under the bus in some parts of the world. I will also be taking exception to two incorrect things that Praxis Prepper said recently on a video, which goes to my point, is that normalcy bias can affect people who don't believe they have it.
The SAGE papers yesterday, Mr. Speaker, make clear that with high infection rates, there's a greater chance of new variants emerging, greater pressure on the NHS, more people will get long COVID, and test and trace will be less effective. Knowing all that, is the Prime Minister really comfortable with a plan that means 100,000 people catching this virus every day and everything that that entails?
So 100,000 new cases a day by the end of July is pretty stunning. They're on track for that. Today there was like just over 32,000 cases, this being the 10th of July 2021. But who really cares how many cases of COVID there are? The question is, how many of those cases require hospital care, and how many of those die? And how many of those get long COVID seems to have been ignored. Right now at the beginning of this third wave, increased trends in hospitalisation and deaths are starting to become quite apparent.
We will continue with a balanced and reasonable approach, and I've given the reasons. This country has rolled out the fastest vaccination programme anywhere in Europe. The vaccines provide more than 90% protection against hospitalisation, both of them, Mr. Speaker. By the 19th of July, we will have vaccinated, every adult will have been offered one vaccination. Everybody over 40, Mr. Speaker, will have been offered two vaccinations. That is an extraordinary achievement. That's allowing us to go ahead.
So let's be clear, despite people like Praxis saying rubbish online, if you are double vaccinated and 3 weeks or 4 weeks have gone by, the chance of you being hospitalised with COVID or even dying from COVID are really, really small. But if you're the Prime Minister of the United Kingdom, does that mean you look at the 30% of your population who are completely unvaccinated and say, personal accountability, they could have been vaccinated, their choice.
We all want restrictions lifted, we want our economy open, and we want to get back to normal. But we've been here too many times before. Isn't it the case that once again, instead of a careful, controlled approach, we're heading for a summer of chaos and confusion?
This is to be decided, and it will be played out very much in the public sphere. But what is true is that masking and social distancing in the public sphere cost little to nothing and should be maintained, not just thrown away. The United Kingdom under the Prime Ministership of Johnson has in fact done this type of thing before. They have form, if you want to use a criminal analogy. They actually have opened up with cases rising before, and it has led to an awful lot of deaths in the United Kingdom.
Minister, if we'd followed his advice, we would still be in the European Medicines Agency, and we would never, we would never have rolled out the vaccines as fast. If we'd followed his advice, Mr. Speaker, we would never have got schools open again with all the damage to kids' education. And frankly, Mr. Speaker, if we listened to him, we would not now be proceeding cautiously, pragmatically, sensibly to reopen our society and our economy and give people back the chance to enjoy the freedoms they love. We're getting on with taking the tough decisions to take this country forward, Mr. Speaker. We vaccinate, they vacillate, we inoculate, Mr. Speaker, while they're invertebrate.
Politics, eh? So who's right? Probably neither, probably both. But what is true is that Johnson wants to increase the length of time children are spending in school.
We're looking at the evidence, and if I'm absolutely frank with you and the committee, to begin with, some of the evidence that was assembled was not as good as it could have been. The evidence on timetable, the evidence on lengthening the school day wasn't as powerful as it was on tuition, for instance. But that doesn't mean it's not the right thing to do. I do think it's the right thing to do. The question is how you do it, what sort of activities? Is it enrichment? Is it academic? What's the mixture? As you rightly say, we're doing a proper review of all of that to get the evidence that we want.
Pay particular attention to how he's saying what he's saying here. It's quite indicative of his state of mind. Yes, he knows there's no evidence. He believes it's correct, so he's going to do it anyway. And he's going to make sure that he actually gets, and I quote here directly, the evidence we want.
We're doing a proper review of all of that to get the evidence that we want.
Politics has no place in public health, in deciding policies that decide whether people live or die. No place. Not as gut reactions, not as belief. Belief that this was SARS-2 in my hospital allowed people to walk around with no masks on at all right the way through June, because our infection prevention control people could not comprehend that this was airborne, not contact. You may well be right. If you are double vaccinated, the chances of Delta and Lambda variants affecting you are kind of remote. But, and this is the interesting fact, 31.9% of the British population to date have no vaccination on board at all. So fully almost a third of the entire population are in the same amount of risk for COVID as they were at the beginning of the outbreak. Now, yeah, a few of them had COVID and recovered, so they're possibly at less risk, we don't know. But that's a huge percentage of people. That's almost 20 million people that the Prime Minister is going to put at risk simply because he doesn't want to enforce masking and distancing any longer. You can reopen with both. These three graphs are from a couple of days ago, and they actually show the lag that's going on. So you clearly see there is a third wave starting in the United Kingdom. There's no doubt about that. This is definitely the beginning of a third wave. Whether it will peter off and be tiny, whether it will just keep taking off, we don't know. What we do know is that hospitalizations are lagging behind cases and deaths are lagging behind. Now, if you take that data point and say, well, it's going to stay low, let's open up anyway, because who cares? What we've seen in the past is a 2 to 3 week lag. And that's what's got people in the United Kingdom concerned. They're in favour of reopening as much as possible on July 19th, but a full opening with no masking and no distancing being enforced makes people nervous, and in my opinion, rightly so.
The first one I want to talk about is related to COVID and vaccines and people who haven't gotten vaccines and people who have gotten vaccines, the new variants that are coming out. It's been my feeling since the beginning to kind of hold off and see where things go with the vaccines. They're new, I don't know, it's arguable, but it feels to me like they got rushed out a lot. And, we don't know, what all the side effects are related to those, and we don't know how long they're going to be effective, over, the midterm or the long term.
Praxis has said what he thinks about the whole issue here, and I think it's really interesting because it's really indicative of normalcy bias. He doesn't believe that he should get vaccinated because of various reasons, which he explains, almost all of which are actually not true. And I'm going to not demolish his argument, but I'm going to offer him a bit of thought, if he's open to it, to actually try and think about what he's doing and what he's saying and why. So he's saying that because the vaccinations have been rushed, which they were, and because vaccines have side effects, which they all do, that he would prefer to stay unvaccinated, despite the fact 600,000 of his fellow Americans have died of the disease. I don't think 600,000 Americans have died from vaccination side effects. The majority of people who died from COVID-19 in the United States and elsewhere were unvaccinated. So he's decided to put himself in the unvaccinated group. And Praxis, Delta's old news.
Well, with the Delta variant, it's starting to spread around the world. The Delta variant is the fourth, major, dangerous variant of the disease that's been identified. It's one that had first been, isolated within some people in India. And this one is starting to travel around the world. It's more contagious, and there's some data to suggest that it might be more dangerous as well. Well, in some countries of the world that it's already getting into, I'm going to talk specifically about Israel as an example, about half of the people who have been infected with this new variant are people who have been fully vaccinated.
But of course, nobody ever said the vaccines were 100% effective. And if the majority of your population, like Israel, I think it's over 60% are double vaccinated, when you are testing the population anyway, you will find positive COVID infections in the vaccinated. The difference between the vaccinated and the unvaccinated isn't that vaccinations haven't worked, it's that they don't tend to go to hospital and die. That's the difference. It's not rocket science.
You know, like I said, it's my take on the vaccine since the beginning is like, well, let's wait and see. You know, we don't know how effective this thing's going to be. And the data, at least in its relation to the current set of, I think that this is a lot of the Pfizer and the Moderna vaccines, it looks like, you know, they're already starting to not be very effective.
So he's going to wait and see. I have no idea what he's waiting for or what he's looking to see. It's a really foolhardy opinion. And it's an opinion, not based on science at all. Claims that the vaccinations are not very effective against the new variants. I don't know if he knows about Lambda, but Delta variant, if you're double vaccinated, it's 88% effective. 88% effective. How you can claim that is not very effective shows that he doesn't want it to be effective, because if it is effective, his stance of being hesitant on vaccination makes him look kind of bad.
It's kind of like, you know, you just bought the new iPhone and, you know, it's already out of date. You already got the next one that's, you know, coming out, and it's like, you know, you've already got old tech, doesn't even work anymore.
So you're on the Titanic and it may or may not be sinking. A few people have died in the lower decks. People are kind of worried. Nothing's really going on. You're still listening to the band at the bar and drinking a scotch. And somebody says to you, you know what, the ship's going down. I think maybe you should get into a lifeboat. And you look at the lifeboat, you say, I'm not getting into that. It's got a tiny leak in it. That is what Praxis's statement is. That's his stance. We know vaccines work very, very well to prevent death, long COVID, and hospitalizations. We know there's a new wave coming globally. We know that at least the Delta and the Lambda variants are there, and I believe there is in fact now a third variant that appear to be more infectious and more deadly than the original SARS-CoV-2 variant. So yeah, that's my opinion. He's entitled to his opinion. That's how it works, right? You can be a complete incorrect opinion and say it like it's true, and you have every right to say that. I don't agree. I think you have a duty, if you wish to talk about something that's going to kill people, that has killed people online, you should actually do a little bit of basic research. So let's do a bit of basic research for Praxis Prepper. The UK data clearly shows at the beginning of the wave 3. Clearly shows that. It clearly shows that so far at the beginning of the wave, hospitalizations and deaths are a lot less than they were at this time during wave 2. So Johnson might be right. There may not be a huge price in deaths to pay to fully reopen without any restrictions, but he may also be wrong, and these could be lagging 2 to 3 weeks and then take off like this, in which case he'll probably blame somebody other than himself. There is nothing wrong with reopening in the United Kingdom, or in Canada as we're doing, if you maintain social distancing and masking. So far they're attempting to maintain social distancing and masking here, but they're doing a very poor job of it.
We would ask governments to be really careful at this moment, not to lose the gains you've made, to open up very carefully. We've seen over the last 6 months, case after case, country after country, in which there was a lot of increase in social mixing without adequate vaccine coverage, and we've seen wave after wave of cases. I would hope that in the European environment we won't see a return to the overwhelmed hospitals and the exhausted health workers. But that's not a given. This virus is evolving, this virus is changing, and we need to be very, very careful at this moment so that the gains that have been hard won by the behaviours and action of our population are sustained.
So if cases are a lot worse but hospitalizations and deaths are barely significant, then yeah, I totally agree. It's just nothing, let's open up again. The problem is that we know from waves 1, 2 and some parts of the world 3 that the unvaccinated will get it, about 2% of them will die. Mostly they'll be older, but not exclusively. Some will be children, we know that. Some will have injuries and diseases, we know that. But normal, healthy people who look exactly like Praxis Prepper have died from COVID-19 and will die from COVID-19. And it strikes me as kind of sad when there's a vaccine available that reduces those chances of death, long COVID and hospitalization dramatically. In a lot of ways, it's the government's fault all across the world. They tend to be open or shut. And shut is partial, so some businesses are affected and others are not. Like, you need to be open with social distancing and masking the entire time until we have achieved a vaccine that's pretty much 100% compliant with the population and effective. We're nowhere near that, nowhere near that. And yet we're acting like COVID's gone away. And certainly in Ontario, people are very much thinking it's gone away. People are booking trips to Vancouver. They're all excited to get on planes with other people because they have a surgical mask on and use the same toilet, and then go to Vancouver and go to the sites and be crowded in. I do think human patience needs to be a little bit better than it is. There's nothing particularly wrong with waiting 2 to 4 to 6 more weeks and enjoying social distance unmasked outdoors without throwing everything away.
The idea that everyone is protected and it's kumbaya and everything goes back to normal, I think right now is a very dangerous assumption anywhere in the world, and it's still a dangerous assumption in the European environment. There are a lot of gains have been won over the last number of months. Many countries have suffered. Even the high vaccination countries have suffered. Their health systems have suffered. We need to think about what we truly value.
True, values, not politics, and I distrust any politician that says that. Our value should be to do whatever we can safely do and effectively do to protect and help other people, not just ourselves. The amount of selfishness that I've seen in the COVID-19 from the prepper community and the normal community is absolutely disgusting. Get vaccinated. If you don't think you're at risk, you are at risk of passing it to somebody else. That's always been the case. These are not untried, untested, made up, high side effect vaccinations. Yes, some have been brought in, some have been removed. There's been some AstraZeneca and Moderna and Johnson & Johnson. There's a few issues with some of the vaccines. It's all available online. It's easy to figure it out. If you don't want to get COVID-19 and you're not vaccinated, go and get the Pfizer vaccine and get both doses and stay socially distanced and masked until you do. And even when you're fully vaccinated, like I am finally, wear a mask in public. Why not? Wash your hands. Why not? Keep distanced. Why not? The risk of infection is tiny once you're vaccinated, but it's there and it's in the community.
And research is suggesting the case count here locally may be much higher than what's being reported. Doctors in Southern Nevada are studying the trends of the virus by what comes out of the valley's wastewater.
Doctors are concerned about just how widespread the Delta variant may be here in the valley. They're also concerned about the emergence of the Lambda variant, which was originally found in Peru. Right now, the Southern Nevada Health District is reporting 269 Delta variant cases and no official record of the Lambda variant. But if it's showing up in our sewage, it will likely show up in tests soon. Dr. Edwin O, associate professor at UNLV School of Medicine, says they found the Delta variant in every single wastewater facility in Southern Nevada, suggesting it's widespread. He says a recent analysis shows case counts are going down in low-income neighborhoods and case counts going up in high-income neighborhoods. Dr. O suggests the discrepancy in numbers is due to lack of testing.
One of the possible explanations for this scenario is that the number of testing sites in low-income neighborhoods have gone away. They've gone down. And so really, if you're getting tested now, you potentially have the time and or the means to do so.
Now, Dr. O believes the amount of air travel that is picking back up may also be a factor in the Lambda variant now showing up in our wastewater. He says the best way to fight these numbers as they climb is to get vaccinated. And you have the potential for winning up to $1 million if you are vaccinated. The winner for that, or at least one of the first winners, will be announced today. Details on how to make sure you are eligible in the next half hour.
So at the end of the day, why should Praxis Prepper get vaccinated? Actually, if you think about it pragmatically, I couldn't care less. I'm fully vaccinated. If the unvaccinated, the vaccine resistant, the vaccine hesitant choose to risk death, hospitalization along COVID, what do I care? You know what? It's going to cause another lockdown. The very thing they're actually complaining about is going to be triggered by overwhelmed health services full of unvaccinated and partially vaccinated people with the Delta and Lambda variants get in, and they are in. What a simply glorious day. I'm glad I trucked all the way down here and got into the near wilds. It was actually a bit of a hike to get in here through the brambles. But one of the things I would like to say before I sign off is do your own research. It's pretty obvious to me that not being vaccinated in July of 2021, when you're in a rich country that's offering free vaccinations, is a stance that is simply mind-numbing. It's simply mind-numbing. And the decision not to wear a mask in public when you're crowded and not to wash your hands and keep social distances where you easily can strikes me as bizarre. Like they're fighting against something that doesn't exist. The COVID vaccination doesn't care what you do, nor does the COVID vaccine. Neither of them care. I do, and I would appeal to Praxis Prepper to look into this more deeply. So actually think about what you're doing, think about where your source of information are coming from. Why are you online talking about medical science when you've got no background in health sciences. It just actually causes even more confusion and more vaccine resistance, which makes lockdown and deaths more likely. Toodles. This has been a 2021 Wolfie Terrier production in the sun.